Hi there. I want to give you a brief overview of our recall system, and this is the recall overview template. It is really busy, particularly at first glance. Once you get used to it, hopefully it becomes really useful. This is on a test patient, so it's got kind of more going on than perhaps you'd normally expect, but I'll talk you through it. So first off, at the top, we've got the recall status, and there's two parts to this. LTC Blue, LTC stands for long-term conditions, and that's basically the annual review, and blue means it's pending. If you click on the drop down, it'll give you a bit more information. So the patient will be invited to come for the annual review later in the year. People are normally invited around their birth month, but that can change for various reasons. But this shows you what's going on here. This shows that whilst their annual review is not due, they have got monitoring tests due, and that could be blood tests, or it could be blood pressure or other things. Here we've got blood tests that are due, all the different kinds, and it tells you who to assign the blood tests to. So you can see on this occasion that they were last requested by RB, which I think is Rachel Brown. If you click on this one here, or if you need to, if you don't know who RB is, you can right click, do show journal entry, and you can see yes, it's Rachel Brown there. Most of the time you wouldn't be worrying about that unless you're HCA taking bloods. You can see what what observations are due, so blood pressure and a urine sample. The reviews that are still needed when their reviews come round. If some reviews have been completed, it will show you that here as well. This section here then shows other things that might need doing for the patient. So for example, dispensing review of medicines. You could offer social prescribing, shingles, vac, those sorts of things. If the patient's got any outstanding QOF alerts, they would show here. Because the patient's a test patient, they don't. Any annual review codes, so like asthma review, COPD review, they'll be displayed here. Then you can see the reasons for, and you'd also see any invites that we'd sent here as well. You can then see the reasons for the different monitoring. So quite a lot of queries from patients can be why do they need to come in for bloods. So you can see there's ad hoc requests by clinician. That's what Rachel had done. Here you've got the patients on an ACE or an ARB, which means that every 12 months they need UNEs. And you can go through each one and you can see the time scales and what things are needed. Similarly, you can see the conditions that we monitor. So where it's 12 months, those will just be done at their annual review. But for example, valsartan is every 3 months, so certain times in the year they'd just be having the things that are needed for the 3-monthly monitoring. At other points they come in for their full review. It also shows you, just for further info really, any results in the last 18 months and the current repeats. As much as possible it tries to be self-explanatory, and often if you click on the arrows here, not on those ones evidently, certainly on these ones at the top, and some of them it will give you a bit more information as well. On the right hand side, this is really what HCAs and nurses will be using. The blood sample taken protocol launches and records that a blood sample has been taken, codes all the various things, and crucially it will ask what bloods are taken, and if you're taking what's displayed here, which will be the most common thing, it will code all of those so we can reconcile those bloods. You've got options like sending the invite or booking an appointment, sending the monitoring invite. It's kind of core obs stuff that HCAs might be doing on lots of patients, particularly if they're just coming in for monitoring. Then you've got links to more detailed templates, so like our vaccination template for flu, pneumo, shingles, separate instruction video for that. And then at the bottom here you've got disease-specific review templates. These link to the relevant ARDENS templates, the reviews. Some of them are greyed out because the patient's not got that condition and you're not likely to want to use it anyway. And then those templates generally got their own review codes. If you've done an annual review and you've not ticked any codes there, then if you tick that one there, the system will know that they've had their review and we won't invite them in again for their annual review that year. So that's the first page. I'm going to show you a bit more detail, which not many of you will need but might be useful, which is on changing the recall. And there's a few particular points here. So for example, a patient, I don't know, let's say they're in hospital and they want to delay the monitoring. So if you click on this option here, it will ask you how long you want to delay it, and you've got 6 weeks, 3 months, or 6 months. That means they won't get an invite until that time has passed, or don't delay. If they've got diabetes, you can choose whether they're under the care of the practice or hospital. You need to be careful doing this stuff, because if you pick hospital only, we won't invite them for diabetic reviews. But obviously for some patients that's appropriate. If you want to add on one-off tests, you click on this one here, which is also on your toolbars. Again, there's a demo for this separately, so I'm not going to spend time on that. So here you can set up or amend regular monitoring. This is really useful if, say, the hospital says, for whatever reason, this patient needs a particular blood test every 6 months or something. You click on this and you set the time frame that's needed. So let's go with 6 months. And here's a common one, perhaps PSA monitoring. And I don't know why, but you might have something else that needs doing at the same time. Let's put blood pressure in. And you can tick these other options. The beauty of this is it will then include these things in the other, along with the other monitoring. So it won't be like a separate system or separate invite. It'll just get folded in and included with everything else. And you can OK that. If you were to save the record and then re-retrieve it, I'm just going to re-evaluate the alerts to show you this. You'd also see here that PSA 6 monthly monitoring has been set up, and you could also remove that on a future date if you needed to. Then over here, again, this is not to be done lightly. You can change the place of care for high-risk drugs, and it makes it very clear where the monitoring is by the practice or not. So if you put no monitoring by practice, we won't invite them anymore for high-risk drug monitoring. So don't do that unless you're absolutely sure that's the case. You can tick to say we've got a shared care agreement in place, and then similarly got the location of prostate monitoring. Often that's under the hospital at first. If it's under the hospital, then we probably wouldn't be needing to pick the PSA anyway. Unless you've opted the patient out by clicking on secondary care, we will be inviting them in. And then there's a few other options here, again, like the send LTC invite and so on. If you're not sure, it's best to leave this. But rather than sending a task to me or someone else, if you've got a request or there's something on the notes that says they need regular monitoring, then it's better to set it up this way. You don't need to create scheduled tasks. You don't need to put alerts on the home screen. No report's going to pick up an alert. It's really hit and miss. That's the way to do it. If you've got any queries, problems with that, new task me, or there's, in fact, better, there is an IT support group at every unit. So any queries go there, and either I or someone else will pick that up and get back to you. And that's all. Thanks.